Okay, hello. My name is Eden Endress. This is my HEENT video. This is a 360 scan of the room. There's no laptops, computers, only my phone that's recording. Okay, hello, my name is Eden Endress. I'll be your student nurse practitioner today. We are going to do a HEENT exam today, which is of the head, ears, eyes, nose, and throat. Ready to get started?
Yes.
Okay. First, we're going to start out with the visual acuity test. So if you could hold this card 14 inches out in front of you. And then what I'm going to have you do, maybe just a little further, is use both eyes and read the smallest line that you can.
LTFPH.
Perfect, and then go ahead and cover your left eye. And then again, read the smallest line you can, but read it backwards this time.
HPFTL.
Okay, go ahead and switch hands to the other side. Same thing, go ahead and read the smallest line you can. You can read it from the front this time.
LTFPH.
All right, thank you. So that would be 20/20 vision, which is perfect. And then the next I'm going to do an eye cover test, so just look straight at me and I'm going to cover one eye while looking at the other. Looking for any changes in either eye. No changes on the left side. And no changes in muscle there, which is normal. Next, we're going to do some visual field testing. So I'm just going to have you look straight at me. This is testing your peripheral vision. So you're going to see my hands wiggle. Just let me know which side you see.
Left. Right.
Okay. And then we're going to do the same thing with both eyes, but just tell me when you can see my fingers moving. Okay.
No. 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 No.
Okay. And then we're going to do the same thing with one eye covered. So go ahead and cover your right eye. I'm going to cover my left. And then same thing, just let me know when you can see my fingers wiggling.
Yes. 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 Yes.
Okay. Take a minute, we're going to switch numbers. Okay.
Yep. Yes. Yes. Yes.
Okay. Done with that one. And then the next thing, I'm going to have you close your eyelids. Just going to take a look at your eyes. I'm looking for any like abnormalities of your skin, but everything looks good, dry. There's no excess dryness. I'm going to have you open your eyes, and I'm going to take a look at your pupil, your cornea and your pupil. So you can look up, look down, look to the side, other side. Very good. I'm going to test your accommodation, so keep your eyes on my fingers. Very good. You can just look straight at the wall for me. This is going to be me looking at your cornea and your lenses. So I'm looking for any scratches, swelling, unusual coloring of the sclera and the conjunctiva. Okay, everything looks good. Your sclera is white, which is a normal color. Your conjunctiva is not excessively pink. I'm looking at your lacrimal duct apparatus, which is your tear ducts, and just seeing they look pink and moist. There's no drainage coming from them. We're gonna do some more checking of your pupils real quick. So just look straight at me. I'm gonna shine a light in your eye twice on each side. I'm looking for direct constriction of your pupils, which is the first pass. I'm looking at each eye to make sure it constricts, and then this one I'm looking for consensual constriction in your opposite eye. Very good. Okay, and then just look straight at me. I'm going to test your corneal light reflex. And I can see equal light on each eye of the cornea, so those are equal, which is normal as well. Let's see here. This next one is going to test your extraocular motors. So I'm going to have you keep your head straight. Just use your eyes to follow my finger, please. And for For this one, I'm looking for any abnormal movements, any nystagmus, any lid lag. Looking for, perfect. So there was no abnormal movement under your eye muscles there. Everything was good. And then this next one, which is the last one, we're gonna look at closer at the back of your eyes, also known as a fundoscopic exam. So for the right eye, I'm gonna stand at a 15-degree angle, and then if you could just pick a spot on the wall or in this cabinet, just go ahead and look directly at that plant the whole time for me. I'm gonna come in from like a 20-degree angle using my right eye and look for your red reflex. Then we'll follow it in. You're gonna feel me put my hand on your head just to kind of steady myself, and I'm gonna get real close here. Just keep looking at that spot. And I'm gonna use my diaper to adjust as I get closer. Okay, very good. So I can see your optic disc. It looks good. There's no papilledema. I can see the veins in the arteries, and I'm gonna switch for the other side. I'm gonna use my left eye and find your red reflex again. Just keep looking at that spot for me. I'm gonna follow it in. Again, you're gonna feel me on your, and I'm gonna get close. Lost it. Find it again. This is just looking at the back of your eye. Okay, very good. I can see your optic disc, and then your veins and your arteries. Everything looks normal. There's no hemorrhage or abnormal coloration. It looks nice and kind of a creamy yellow back there. Okay, I'm gonna turn the lights back on. We are done with the eye portion of the exam, and the next portion is looking at your ears. So I'm gonna get this ready. First, I'm gonna start by touching and feeling your ears. If there's any pain or tenderness, let me know. Checking the auricle, the tragus, any pain?
No.
And I'm gonna palpate your mastoid. Take a look back here. No lesions, no masses. Same thing on this side. Just palpating. Let me know if there's any pain or tenderness. Assessing the tragus. Looking behind your ear. Everything's good there. Now I'm just going to take a look inside your ears. So I'm going to pull this portion up. Looking inside the ear canal, nice and clear. And I can see the tympanic membrane, it's intact, no excessive redness, and I can see you have a good cone of light. And then for this side, I'm going to switch hands to my left, hold up with my right. Again, you can see the ear canal to the back. Looks good back there. No redness, no swelling, no drainage noted. Ear canal is intact in the tympanic membrane. And then this one is going to be a whisper test. I'm going to have you turn towards the window. Actually, go ahead and stand up for me and face that way. I'm going to be standing behind you. I'm going to have you cover your right ear with your finger and kind of rub at it. And then you're going to hear me whisper a set of 3 letters or numbers, and I want you to repeat it back to me.
KH9.
Okay, very good. And then we're going to switch sides. Do the same thing on the left. Give it a rub and push.
C25.
Okay, very good. And then the next is a Weber test. You can go ahead and sit back down. I don't have a tuning fork, so we're going to pretend this is my tuning fork. And you're going to feel me place this on the top of your head. When I place it, let me know if you can hear the sound in both ears, or if it's greater in one ear than the other.
Yes, I can hear you both
Equally?
Yes.
Okay. And then this next one is called a ringing test. So I'm gonna tap my tuning fork and you're gonna feel me behind your ear back here and let me know when the noise stops.
Stopped.
Can you still hear it?
No. Yes.
Okay, that's fine. And then we're gonna switch to the other side. I'm gonna hit my tuning fork. Let me know when the noise stops.
It stopped.
And then can you still hear it?
Yes.
Okay, very good. So normally air conduction is longer than bone conduction. So on this side it was abnormal since it stopped, since you could not hear it once your bone conduction was done, but on this side it was normal. Okay, so next we're gonna move on to the exam of your nose. I'm just looking at both sides here for symmetry. I'm gonna feel for any crepitus or masses. It looks symmetric to me. There's no abnormal tissue noted on the outside. Go ahead and take one finger, take a breath in, and then do the same thing on the other side. Very good. And then I'm gonna have you stand up for this next part if you don't mind, and just put it inside your nose. I'm gonna turn this point up. You can maybe put your head down just a little bit. Just gonna put my speculum past your nose hairs and take a look. Okay, and then I'm gonna switch sides. Everything looks good. I'm looking for any polyps or drainage or bleeding. And there is a little bit of kind of like exudate, white exudate on the side, the right side. Which could be from allergies or something like that. And then next we're gonna do, I'm just gonna palpate your sinuses. So you're gonna feel me here in the front. Let me know if there's any pain or tenderness. Any pain or tenderness there?
No.
Okay, I'm gonna do your maxillary sinuses. Any pain or tenderness?
No.
Awesome. And then for the next part of the exam, we're just gonna look at your mouth. So I'm looking at your lips here. I'm seeing nice intact lips. There's no dry skin noted, and the corners of your lips look intact. As well as have you say stick your tongue out. Very good. I'm looking in the back of your throat. I can see tonsils. I'm gonna just use this to press down a little bit. Go ahead and say Very good. Your uvula is midline. Hard and soft palate are intact with no drainage or masses seen. I'm gonna use this to kind of just move your cheeks around and look at the rest of your tissues. Your gingiva look good. They're nice and pink. There's no lesions or masses on them. There's no drainage, no excess plaque. Very good. And then the last part is your lymph nodes. So I'm gonna do kind of a lymph node exam here. Can I have you unbutton those two? Because I will be feeling around down here. So first I'm gonna feel for your mental lymph nodes. And I'm just feeling for any abnormal lumps or bumps. Let me know if you have any pain or tenderness. This is the submandibular lymph nodes. Feeling your tonsillar lymph nodes. I'm just using a nice circular motion. I'm going to work my way down your neck. These are the anterior cervical lymph nodes. I'm going to feel down the other side of your muscle for the posterior cervical lymph nodes. I'm going to feel back here for your occipital lymph nodes. Good. I'm not feeling any hard lumps or bumps, which is good. I'm gonna feel right here, which is your supraclavicular on each side. Not feeling any large bumps. And then infraclavicular, just a little bit in front of the clavicle. And again, I'm not feeling any lumps or bumps, which is normal. All right, that concludes our exam. Thank you.